Peace and blessings, everyone. Welcome to Spotlight. I'm Ejuenka, and we have a very important program for you this evening. With me is Sister Gracia Wheatley. She's the Chief of Drugs and Pharmaceutical Services in the Ministry of Health and Social Development. We're going to talk about counterfeit medicines, the dangers of counterfeit medicines, how you can detect counterfeit medicines, what to look for when you're ordering your medicines, and what harm they present to you when you do encounter counterfeit medicines. I want to remind everyone that we are also streaming live on jtvlive.net for those of you who are close to your computers or know some friends around the world that you want to call and let them know that they can catch Spotlight live on jtvlive.net. We're going to take a break for a word from our sponsors, and we're going to come back with Sister Gracia Wheatley, and we're going to start to inform you about the dangers of counterfeit medicines and what can you do to protect yourself. We'll be right back after these words from our sponsors.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Roadtown, Tortola, BVI.
Welcome back to Spotlight. I want to welcome my guest, Sister Gracia Wheatley. It's good to see you.
Yes, Ejuenka, same here.
Yes, indeed. Chief of Drugs and Pharmaceutical Services.
Yes, sir.
That's how old is that position? Is that a new position? Or?
It's not new now, since 2009, April the 4th, I think. Yes.
Okay, about 3 years old.
Yes, just a toddler still.
Yeah, and that post was created for what reason?
Well, actually the World Health Organization recommended that each country should have in its Ministry of Health a regulatory body in reference to pharmaceuticals so that it can regulate the industry and the practice, ensuring that pharmacists are licensed and up to date, that the establishments that practice pharmacy, that they are storing the medications properly, that they are selling them properly, and they are importing them from reputable sources, so that dangers like counterfeit medicines and substandard drugs, medicines, as far as possible, will not infiltrate the medicine chain.
Okay, so if someone wants to open up a pharmacy, they have to come through you?
Oh no, not at this point. Our laws are still being drafted, and right now they would have to apply through Trade Department, and Trade would liaise with the Ministry of Health, the Chief Medical Officer, and myself for recommendations. Yes.
Okay, so do you go out periodically and take a look? I mean, how do you know when counterfeit drugs are coming? How do you know if the pharmacies are doing a good job, if they're mixing the medicines right, giving you the right portions, giving you the right types of medicine, the right brands? It's not counterfeit, it's not substandard. Is there an inspection process or anything that comes out of your office or anywhere in the government?
Yes, built into the job description, there's an inspection responsibility. So periodically, I do visit the pharmacies, the hospital, and inspect to ensure that medicines are being stored properly by using equipment to check the air conditioning temperature, looking at the shelves, ensure that they're being stored properly by expiry date, and that expired drugs are not being dispensed, and so forth. Yes, so there is an inspecting aspect of the job. Yes.
Okay, so you do spot checks, you just show up, you don't make an appointment sometimes to try to catch the pharmacy before they hide the drugs?
I don't make an appointment. I would just go and say I'm here to look at something. Or I would just go basically and walk around like a consumer and, you know,
just check
inspect.
Out the store?
Yes.
Okay.
Sometimes I try and go unofficially and see what I can see. Yes.
Okay. Now tonight we're talking about counterfeit medicines. Why are we talking about counterfeit medicines now? Is that a problem in the BVI?
Counterfeit medicines is not a problem only in the BVI. It's actually a global health threat because counterfeit medicines are all over the world. The World Health Organization has estimated that 10% of the medicines dispensed in the world of counterfeit medicine. 10%. 10% is of counterfeit medicines, yes. And BVI, we called ourselves Nature's Little Secrets. We are proud on being Nature's Little Secrets. But we have been discovered by many illicit activities.
Unscrupulous characters.
Oh, yes. We are no longer Nature's Little Secrets. We are out there, and whatever's impacting the world, be it good or bad, unfortunately is impacting all Nature's Little Secrets. And so we must be aware and do not be living like an ostrich with our head buried in the sand, that these things will not come to our beautiful blue shores.
Well, just when we thought we were safe, huh?
Just when we thought we were safe.
I guess counterfeit medicine, like counterfeit money, must be a big business, because there's a lot of health issues, a lot of people need medicine, so it's a big business. Now, how do you detect, how do you know when something is counterfeit, when a drug is counterfeit?
Well, it may not be easy to detect, especially if the method of counterfeiting was excellent. Sometimes authentic companies do have trouble identifying the counterfeit medicine to their medicine. That is true, because with all the technology that we have, it is so good that sometimes you have difficulty, and it is only by testing in a lab, if it is that good, that you can find out that it is counterfeit. Now, sometimes the job is so shabby that you can look at the packaging and you can see the way the expiry date is written. You can look at how the lot number is written, and you can see, you can look at the holograms on the tablet container itself, and you can see that that is not an authentic manufacturing process. But otherwise to that, testing is the key.
So you could get a counterfeit brand name drug. It'll be a look-alike brand name package, but it'll be counterfeit?
Yes, you can. The standard definition for counterfeit medicines is that a counterfeit medicine is one which is deliberately and fraudulently mislabeled as to its true identity and its source. Okay, so it may be saying it's amoxil, but it's not amoxil. It can be saying it's coming from the drug company Pfizer, which is a multi-billion company that manufactures medicine, but it's not coming from Pfizer. And it can be a brand product coming from a company like Pfizer, or it can be a generic product. So brand and generic, all are counterfeited. Just recently, Lipitor, what we use to lower atorvastatin, what we use to lower our cholesterol, made by Pfizer, which is a branded product, that was counterfeited. You know.
Now, what is used to be a substitute for the real thing? Is it something that's harmful to you?
Oh, Edgewinker, counterfeiters have no respect for us. They have no respect to the health problems that can impact us by ingesting their medication. There have been cases in Brazil. There was a case with oral contraceptives, and these ladies that were accessing service at a particular family life clinic, although they were on contraceptives, they found all of them were getting pregnant. So the government decided to test the oral contraceptives, and what they found in that was ground up glass. Ground up glass. There have been tests where it revealed that what was in it was nothing else but talcum powder, or even cement. There was a case of cement in the tablet. There have been cases of insulin, and all that was in the insulin vial was water. So sometimes it cannot be harmful, and sometimes it can be detrimental to our health, yes.
Okay. So basically you're sending out the alert to people watching the show that they need to be mindful that when they go to the pharmacist to fill a prescription, to be careful that they could be counterfeit. Well, what do they need to do? Are there steps they need to take, a process they need to go through, an examination process? How can you safeguard yourself from counterfeit medicines?
Well, the first thing I will say is ensure you buy your medicines at a legally registered pharmacy, one that is licensed by the Trade Department, to practice in the BVI because they have been screened, the paperwork has been gone through, etc. The other one I would say is that as much as possible, avoid buying medicines over the internet. I think one of the cases in Canada was a lady who wanted some antibiotics because she had the flu. Now we all know antibiotics cannot cure the flu because the flu is basically a virus, has to run its course. And she decided that she didn't want the trouble, the hassle to go to the doctor to get a prescription to have to fill it. So she ordered the medicine so it can just come directly to her house. That lady died. Because, and when they tested, what they found was in that antibiotic was arsenic. So she died from arsenic poison. Right. So I would say you are playing Russian roulette when you're ordering medicines through the internet. And that is a practice in the BVI where people order medicines through the internet.
It's cheaper. They think it's cheaper. It's convenient. They bombard you, giving you these sale tactics. Buy this, you get this free, and so forth. I've had cases when I was practicing at the hospital where individuals would buy the medicine through the internet and then bring it to the hospital to ask us if it is the real thing. Now we won't know that unless we test it, you know. So also what they need to know is to be familiar with the name of their medication, how it is spelled, because sometimes the counterfeiters are in such a rush to produce so much that the spelling is wrong. So know how it is spelled, know how it tastes, because sometimes if it's cement it would taste different as if it was your real thing. Know how it smells and be familiar with the shape. So examine your prescription when it's filled, so that you're accustomed of identification.
Oh yes.
Of the real product. Now, is there a requirement for pharmacies to have their licenses and their credentials prominently displayed? You know, because you said to make sure that a pharmacy is a legitimate pharmacy. That would mean that you would be able to you'd be able to walk into a pharmacy and look around and see that this person is licensed, that the pharmacist has got his certificate on the wall and is actually a pharmacist, and not somebody just come in and say that they're a pharmacist.
Well, currently pharmacists are not required to display. It is an added advantage to business to let the people know that you have a registered pharmacist working for your establishment. What I think must be displayed at this time would be your trade license from Trade Department, so that people would know that you are an authentic business. The Allied Health Professional Council, this is the council in the Ministry of Health that is responsible for actually overlooking a pharmacist's credential who applies to work in the BVI, and then according to the, what should I say, the passage of yes or no, you are qualified to work in the BVI, then that is forwarded to them. So yes, we do scrutinize pharmacists to practice in the BVI, in the Virgin Islands, sorry.
Right, but wouldn't it, isn't that something that you should look at, though, to have the pharmacist's credentials for the security and the peace of mind of the consumer? This person's credentials is prominently displayed, like the trade licenses in the business, and that's something that you might want to consider.
In the draft legislation that we actually worked on, that is currently with the Attorney General Chambers, that is in it, yes. Okay. They would be required, on passage of this bill into law, they would be required to have these displayed along. It would have a picture part of it, so that you would know who the pharmacist is according to the picture on the certificate and the actual person who's serving you, yes.
Okay. Now, are there any particular drugs that are more counterfeited than others? The counterfeiters have any preference of drugs that you could tell us, so that we could keep our eyes open for this specific type of drug, because this is more prone to be counterfeited than other drugs?
Oh yes, the counterfeiters, in order to make money, they like to counterfeit what we call the lifestyle drugs. You know, the medicines that would lower your cholesterol, lower your hypertension, treat your diabetes, for men erectile dysfunction drugs, yes, medicines. anti-cancer medicines. As recent as a couple of weeks ago, we had the one with Avastin in the U.S. And to bring it home, there is a distributor right in Barbados. So that is being investigated as to whether Avastin is, the counterfeit Avastin is in Barbados, and has it been circulated to patients in Barbados. Yes.
So no, I gotta check.
Lifestyle medicines.
I gotta check for my Viagra.
You gotta check for your Viagra, because that's one of the biggest sellers.
Make sure it's doing what it's supposed to do.
You have to make sure. Yes, Pfizer is very much on top of that, because it is one of the biggest sellers.
Okay, yes. we can take a break for a word from our sponsors. I'm gonna open the phones early because perhaps there's some questions that you have that you want to have asked right away, you want to get answers to, so you could participate in the discussion. So keep it locked right at Spotlight. We'll be right back after these words from our sponsors.
Spotlight is brought to you by CCT Global Communication, DataPro, Orion Law, Clarence Thomas Limited, Virgin Island Motors, and Bolo's Wholesale Cash and Carry.
Welcome back to Spotlight. I'm having a very important discussion with Ms. Gracia Whitley. She's the Chief of Drugs and Pharmaceutical Services in the Ministry of Health and Social Development. And I left off making a joke about checking for Viagra, but Sister Gracie let me to know that it's not a laughing matter, so I better get serious. But I mean, it's serious because those are popular drugs, and people use them a lot.
Yes.
And you're not inclined to think of them as counterfeit. You just the advertisements is good, and you know from first the thing is you don't want anybody to know that you're using them, so you're hiding, and you.
So that may contribute to that aspect.
So it contributes to them. So it is important.
That's one of the factors that promote counterfeit medicines. High prices, when people cannot afford, when medicines are priced too highly in the pharmacy and people cannot afford to get them, they buy them from around the corner or from some place that is not licensed to sell, and you don't know where they came from. You don't know what conditions those medicines were made under. So you're running a risk. One of the other major factors is political will. If the government doesn't take it seriously and doesn't see the need to have legislation to address this menace that is currently happening throughout the globe, well, then you'll just have so many things coming into your country via the ports. If you don't get intersectoral cooperation between the police, between customs, and between the Ministry of Health, where we are watching out because folks are smuggling medicines into the country via their luggage, a lot of things can come in.
So what is being done from a governmental standpoint to intercept, to detect, to gather information, to prevent counterfeit drugs from coming to territories? Like we got the drug task force, and we look to look at illegal drugs, cocaine and marijuana and so on. It seems as though this has a similar requirement, a similar need for police investigatory intervention.
Well, currently, actually, all three departments are working hand in hand. The Ministry of Health, my office, is working with the customs, is working with the police in surveilling the ports of entry, and even businesses and homes where some medicines are being stored illegally. Just recently, in February, there was a workshop on the awareness of counterfeit medicines by the Interpol, International Police, and 3 representatives from the Virgin Islands attended. An officer from Customs Department, Detective Sergeant from the police, and myself. So we were there to present on behalf of the Virgin Islands what we have been doing in reference to raising the awareness of counterfeit medicines in our territory.
So what do we have in place to help to detect or intervene when drugs come to the port? Do we have something a procedure that we go through, that have available to intercept the counterfeit drugs at the ports?
Well, the Customs Department has been very good recently. Well, not recently, even before the inception of the office, they would call the Ministry of Health and report if they had a suspicious package to Dr. Irad Potter, Chief Medical Officer. But since I've taken office, they have called the Ministry of Health to my office, and they've said, Miss Wheatley, we have this package here, we would like for you to come and see. We have confiscated A, B, and C, and we are holding it until you come and let us know what it is, and if we can, you know, give it back to the person that is bringing it in, or if we should confiscate it.
How often you get a call like that? Is that something that's a regular occurrence? How regular of occurrence is that?
Well, up to last week I had a call, yes.
So there's a lot of counterfeit drugs coming into the BVI?
Well, I can't say it was counterfeit at that time, but the awareness is there, and we are working together to safeguard the ports. Yes, we have signs erected. The custom officers are searching the luggage, because what used to happen is that folks would just hide the medicine in their luggage, and these individuals would tell you, oh, where I come from, I can get it off the street, or I can just walk into any shop and buy it. And I'm saying, but how can you buy antibiotics from any shop? These are things that by law must be prescribed.
International law.
International law. Antibiotics should be prescribed, because therefore, if you use the wrong antibiotic to say you're attacking the wrong bacteria, you can get up microbial resistance. So therefore, when you take another antibiotic again, you may find that you're getting sicker, and then you say, oh, the doctor doesn't know what he's doing. When in fact you self-medicated and you created a problem, you know.
Okay, that's something that we need to touch on, even though it's not quite in what we're saying, but I think people need to know about the whole process of self-medication, you know, and taking their medicines as prescribed. But we're going to touch on that a little bit.
Okay.
Right. Now, well, you wanted to tell me about counterfeit drugs, what it is. I mean, you sort of defined it, but it seemed as though you wanted to go into more detail about what counterfeit drugs are.
Well, counterfeit medicines, they are mislabeled, and they're deliberately done so that they will fool you into buying them. But in analysis, what you would find is that counterfeit medicines, most of them would contain dangerous ingredients. Previously, I mentioned glass, I mentioned cement. Some have had talcum powder. Some do not have any active ingredient at all. So when you think you are taking medicines to control your high blood pressure, your hypertension, or your diabetes, and you find, well, I'm very conscientious in taking my medication, but my condition is not being controlled. You may find that you're taking something that has no active ingredient because you didn't buy it from a reputable pharmacy, or you ordered it online. You know, there's some that having too much or too little of the ingredient. So therefore, it may have some amoxicillin, but not enough to kill the bacteria. It may have some paracetamol, but not enough to bring down the fever. Or sometimes the counterfeiter just pour it in, they don't care. So you find that in paracetamol case, too much paracetamol can damage your liver. So you're finding out that you're taking this paracetamol and you're ending up with liver damage, you see. So sometimes they're not labeled with the proper information. So you could take it, and because it's not labeled as to what it is or whatever, you can get a bad reaction to it. You know.
So it becomes very, very important.
Yes,
now,
it is.
We over the years, it's been a situation, you just mentioned it, where we think of brand name drugs as being too expensive.
Yes.
And so companies have taken it upon themselves to make what is called a generic drug.
Generic, yes.
So it's supposed to be the same as the brand name drug, but without the big overhead and the advertising budget and the fancy packaging, but it's supposed to have the same effect.
Yeah.
You know, do we want to be concerned about generic drugs as well as counterfeit drugs? Because that has been a source of relief for many persons who can't afford the brand name medicines. and this might scare them away from generic drugs. So how do we differentiate, and what do you look for?
Well, brand medicine. I prefer brand medicine instead of drugs, because we are trying to separate illicit from right. So brand medicines, usually they are a bit expensive because of all the research and development and promotion that the mother company had to put into getting this medicine to what it is. So it's trying to recoup some of that investment. Okay, so basically that is why it is expensive, but that is only for a time. It is only on what we call a patent. So it's patented for probably 20-30 years. So at that time, no other company can make that medicine. After that patent runs out, then at 30 years, then any other company, the recipe becomes like a free-for-all basically. And any other company can make it because the patent has run out, because the company has more or less recouped the financial investment. But so now they go on with a generic and they make it. But the generic has to go on, undergo testing to make sure that it is what we call therapeutically equivalent. That is, that it will exert the same effect in the body as the brand medicine. So some countries, unfortunately, have a definition of counterfeit medicine that would include generic medicine. But that should not be so, because these generic medicines undergo testing, and they are also manufactured in a controlled environment, observing what we call good manufacturing practices.
No, we get generic drugs over the counter as well. Wouldn't they stand to reason that they're easier to counterfeit a generic drug? It's less packaging, it's just less of a production. So how do we protect the population from the counterfeiters that would also want to counterfeit generic drugs? That would be an issue as well, wouldn't it?
Generic drugs can be counterfeited as well. It depends on the volume. Counterfeiters are looking at fast-moving medicines. And they're also looking at, they counterfeit because what has been the trend is that the penalties are not as harsh as if when you're looking at moving illicit drugs. So a lot of illicit activities, they have moved away from that and are now into counterfeiting because the penalties are not as harsh, right? But
so here in the BVI, do we have penalties for counterfeit drugs? What are our laws like here in the BVI?
Yes, we have laws in reference to medicine storing and dispensing what we call adulterated medicines. There's also the criminal code that speaks to that. Yes, as far as the police is concerned, yes.
So if you get caught with a counterfeit medicine, what happens? Do you get is it considered a drug bust? Is it considered an illegal act? Because you said earlier that when someone comes to the port and the customs officers detect what a suspicious medicine, and they call you, and you have to determine whether it is or it's not, or whether to give them back the counterfeit medicine or confiscate it. It sounds as though we really don't have any laws in place that would deal harshly with persons who are attempting to bring counterfeit medicines into the country.
We do have laws in place.
Have you had any arrests or anything?
No, because we have not as yet gone that far.
Okay.
We are establishing, working together. We are establishing, educating the public about our laws to let them know that it's up to $500 or 6 months imprisonment in the event of adulterated medicines. So we are educating, but we have to move from that phase and now into the prosecution phase. Yes. Okay. So we are working on that aspect.
Okay, we're going to take another break from a word from our sponsors, and when we come back, we're going to have the text and the phone numbers on the screen, so you can help me to ask the questions that need to be asked. We'll be right back after these words from our sponsors.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Rotown, Tortola, BVI.
Welcome back to Spotlight. I'm talking with the Chief of Drugs and Pharmaceutical Services in the Health Service on the Ministry of Health and Social Development, Ms. Gracia Wheatley, and we're talking about counterfeit medicines, the dangers, and the impact that they have on our communities and on those of us who need medication to control our illness or help us to get well. I had a couple of texts, and the number is going to pop up on the screen. Yep, there you go. And you can call us or you can text. A person wanted to go over again, because they tuned in a little late, to go over again what the public should look for. What should you look for when you going to fill your prescription, to be certain that your prescription, you're not getting counterfeit medicine. Let's see if we could develop a procedure for the layperson, the average citizen, to follow when they go to get a prescription filled. You know, get in a habit of doing a list: 1, 2, 3, 4.
Well, my first suggestion would be to access your medicine at a place such as a pharmacy or a hospital that's licensed to conduct that business.
So get comfortable with a pharmacy.
A pharmacy, and know your pharmacist. Converse with your pharmacist. Ensure who is serving you is a pharmacist and not a pharmacy technician or someone else because people who assist pharmacists also wear coats. Okay. But make sure who's serving you is a pharmacist. So
you got to get that license up on the wall. I mean,
we have to get
that license up on the wall.
Hopefully, when the bill goes to cabinet, we will have it passed and we'll be able to implement these measures. Okay. So that our pharmacists will have name tags and you'll know who they are, and you'll know if it's a pharmacist serving you or a pharmacy technician. You'll know if the business is registered and properly licensed, because all of that would turn into inspection, that they are regularly inspected by the Ministry of Health, that would look for certain loopholes, would look over the records and make sure that the manufacturers and the distributors that they're ordering from, that they are reputable people.
Okay, so that's one. Make sure you're dealing with a reputable organization.
Make sure you are dealing with a reputable organization.
And you know your pharmacist and you know the pharmacist.
Don't take it from the man on the street or the gentleman in a shop somewhere behind the door. He has it stored so you don't have to go to the doctor and get a prescription. Okay. Your health is valuable to you, so do what you have to do to safeguard your health. Okay, so that's number one.
So that's number one. Let's take this phone call before we go to number 2. Thank you for calling Spotlight. Go right ahead, please. Thank you for calling Spotlight. Okay, that works. Hopefully, let me see. Okay, good. Everything is set. Okay, that's number 1.
That's number 1. Number 2, the internet and globalization has made things very, very easy for us. And because of convenience, I can stay home, punch a couple keys, and the next thing you know, in a couple of days, the things are here to me. I didn't have to go to a doctor. I didn't have to go to the hospital. I didn't have the headache. I just use my credit card and I have it. A lot of the internet sites, the internet pharmacy sites, they are bogus. In my first year in this office, we got an alert from the UK inquiring into if this online pharmacy is actually established in the Virgin Islands. Now, when I did the route trace and the IP address, it actually was a pharmacy in Chicago. But it was on the website, it had a Virgin Islands telephone number.
Okay, hold on for a second, let's see if it's... Are you there, caller? You have reached Spotlight. Go right ahead, please.
Good night, how are you doing?
Yes, turn your television down very low. Yes. Go ahead.
Yes, hello.
Yes, go right ahead now, please.
I calling in to talk about this same diabetic. The tablet now coming in 60 milligram when it was 30 milligram. I am a diabetic. for nearly over 10 years. And then I went to go back to some pharmacy, and they told me that every 6 months that I have to go and see a doctor to do a new prescription. Then it was 30 milligrams.
And now it's 60 milligrams.
Yeah, it's 60 milligrams now.
Okay, hold on for a second. You understand his question?
I'm not sure what the question
All right.
is.
So, okay, we're not sure what the question is. You say you're diabetic, and when you go to the pharmacy, you used to get tablets that were 30 milligrams per tablet.
Yeah.
And now they're giving you 60 milligrams per tablet.
60 milligrams.
And what you want to know?
I want to know that if these tablets are counterfeit.
Oh, you mean because of the increase in the dosage of the individual tablet?
The dosage, because why give someone 60 milligrams?
Okay.
Well, there may be many factors. Did the physician change the strength of your prescription and you don't know?
Okay.
Okay, so you need to look at that and find out if the physician increased your strength in prescription. Okay. Another thing could be maybe at the time the pharmacy did not have the 30 milligram tablet, so they gave you the 60 milligram and you had to split it in half.
Yeah.
Okay, so those are factors that we need to consider. We just can't off the bat say it is a counterfeit medicine. There are certain factors that we need to consider. And if you're in doubt, you can call, you can revisit your pharmacy and have them relook at your prescription and then advise you accordingly.
Okay.
Okay?
One more question I need to ask. I was diagnosed with bone spur. I went to the people's hospital. They said, I see a doctor. I asked them for an x-ray for bone spur. And they said, the doctor that see me said there is no sort of something named bone spur. So if I know something to forward, you go on a machine and you then start from foundation, and then they prescribe a tool into your boots. I have two options. Either you do it or I do it. But then I went in and I paid $50 for that tool. I never get answers from that, but I know what is bone spur. But I learned it from my country, Guyana.
Hold on a second. You understand what he's saying? Is this something that you can?
No, that's he should visit the hospital. Yes.
The doctor. Yeah, Carla. All right, Ms. Whitley is a pharmacist by profession. A pharmacist by profession, and she's.
Okay, I will ask that same question and see if she can answer to that.
Well, she's not a doctor, so you need to go and talk to another, get a second opinion about the condition. That one doctor said something, you're not satisfied with his answer, you need to go to another doctor and get another opinion to see if their diagnosis coincide with each other, they match each other, so you could get a more comfortable feeling about whether the diagnosis is accurate. If two doctors are saying the same thing, the chances are that both are correct. If one is saying something other than the other, then you know that you need to get another opinion. So you. Okay,
well then I try to give it an example. I'm sorry about what I said, but I'll give it an example that where I went to work in Ghana, Millionaire Street, where they have a Spanish doctor there, and he told me, yes, there's a problem with bone spur, and he would do an x-ray. I did run through the x-ray, and he gave me 6 injections into my heel, and he showed me where the bone spur was turning to go. But in the BB, I will not refuting or saying that the doctor's done is not good. But when I went, I'm a patient to the people's hospital, and I am proud of them. But sometimes when you wrong thing and use the wrong thing, please, we ask them to educate the public with certain types of disease. I watch the program, I learn the program, and I know these tablets then when they're talking about the counterfeit is very bad for the young generation or the older generation.
All right, thank you very much for that call. Okay. All right. I'm not sure what context to put this in, but I think we need to alert the listeners that you're not a doctor, and we're talking specifically about counterfeit medicines. And I think I understand the caller that he's had some challenges. He went to a doctor and he wasn't confident that the doctor was giving the right information, and he got another opinion and he was satisfied. So it turned out good, and it turned out good to be a good thing in the end. And that it's important that when persons are seeking medical attention and they're not comfortable with the information they get from one doctor, it's always good to
get a second opinion
and get a second opinion.
Yes.
Yes. Right. So we were on
the shopping list.
The list of things to look for when you go to purchase, to fill your prescription, and of course to make sure that you're dealing with a reputable company, a pharmacist and pharmacy. And then on the internet, we need to be careful because there are a lot of bogus sites, sites. Is there a way to tell, because we don't want to blanket all sites? Should we refrain from using websites at all to purchase medicines, or are there ways where we could be assured that the medicines that we're getting from the site is a good medicine?
There are internet pharmacies that are licensed to do just that.
How do you determine?
Provide the service via the internet. These sites would, number one, they would be asking for information on a prescription, to whether you fax it in or something, that you can get a prescription to ensure that you are in contact with a physician. And on that prescription is what they will fill. Now, when you visit the site, the sites that are licensed to provide such a service usually have a seal that would give them the authority to do that. So the Canadian licensed internet pharmacies would have a Canadian seal. Those in the UK would have a UK seal. So these seals would look differently. Those in the US would have what we call a seal with the, it's a blue seal, it's oblong, and it has the words in red, VIPPS, mean it's a verified internet pharmacy site. So it's a legit site. Those you can purchase medications from.
Okay, so you look for the seals and the licensing documentation on the site.
Yes.
And more than likely, they will ask you for a prescription to fill. They just won't send you medicine by you typing in the order, or you can't prove to them, or you can't show them that a doctor is actually prescribing this medication for you.
The reputable ones, they require prescription. Yes.
Okay. Now, this is something that a text just came in that I should have thought of, and we becoming more health conscious. We look into alternative treatment modalities, in the BVI now. We have health food stores. The text want to know: do we have counterfeit herbal remedies and herbal medicines as well?
Anything can be counterfeited, Ejewinka. Anything can be counterfeited. A lot of us, we may not be able to afford the brand name clothes or the Rolex watch, so we buy a counterfeit. So anything is possible.
Is that something that you look into, though, or you just look for the pharmaceutical medicines?
If there is, we have an alert system globally. So if an alert reaches my desk, I would be obligated to research it and find out if that is so. There have been instances where there were counterfeit medicines headed to the Virgin Islands, and we were alerted to that through the UK system. They alerted Dr. Irad Potter, the chief medical officer, and then he contacted me and asked me to follow up. They have intercepted medicines on our behalf that were targeted for the Virgin Islands. So we do have an alert system.
International alert system.
International alert system. So we're connected
to persons in the UK, to agencies in the UK, in the US, and Canada who are looking for counterfeit medicines, and you get alerts from them.
Yes, the MHRA, the FDA, Food and Drug Administration, the Medicine and Healthcare Products Regulatory Agency in the UK. Yes. So we do even the OECS PPS, Organization of Eastern Caribbean States Pharmaceutical Procurement Service, of which we buy most of our medication for in the government sector. Yes, we do have an alert system that if one island has concerns with a medicine that is procured through that system, then the headquarters in St. Lucia will send out an alert to the rest of the countries and ask us to look into it and give them feedback.
Okay, we got to take a break, but I still want to know if we still want to go down that list of things to look for. We dealt with the reputable pharmacy, the online sites, and we just want to know what else we should be looking for when we are getting our prescriptions filled so that we can protect ourselves from these counterfeit medicines. You keep it locked right here, the Spotlight. We're going to be right back after these words from our sponsors, with hopefully you on the phone or the text as well.
Spotlight is brought to you by the National Bank of the Virgin Islands, Tortola Concrete Limited, Orion Law, Clarence Thomas Limited, Virgin Island Motors, and Bolo's Wholesale Cash and Carry.
This is Spotlight. If you've just joined us, I'm here with Gracia Wheatley. She is the Chief of Drugs and Pharmaceutical Services in the Ministry of Health and Social Development. And we're talking about counterfeit medicines and how you can safeguard yourself from being a victim of the dangers of counterfeit medicines. And we were going over the list of what to actually look for. And I want you to start from the top again and continue through the list, starting with reputable pharmacy and so on.
Okay, ensure that where you purchase your medication is licensed to perform such a service, because we need to know where the supplies are coming from. We need to know the manufacturers, and we need to know the staffing level, education level of the pharmacist. We need to know that they are trained to know interactions and everything like that. So in reference to internet pharmacies, it is best to refrain, but in the event that you are tempted, ensure that you visit a site and you purchase from a site that has a seal on it indicating that it is an internet pharmacy that is registered to do such a job, to perform internet pharmacy services. The other thing is, do not buy your medicine from the gentleman on the street, because I know we do have individuals here who sell medicines, including herbal products, on the street. Those medicines cannot be stored properly because they are out in the heat, and heat causes decomposition of a lot of pharmaceutical ingredient that can break down into poisonous substances. So do not buy medicines that are on the street, as tempting as it might be. Even if they have the cure for HIV, do not do that. Another thing is what individuals need to look for in reference to therapy is if they have been taking a medicine for a long time and they have been responding very well, and all of a sudden they go to the pharmacy and there's a change, whether in color or something like that, in strength, in color, you're given 2 to make 1. You see that the color has changed, and you all of a sudden realize that you're no longer having a therapeutic effect from that medicine. It needs to be checked. Maybe you have stopped responding to that therapy and it needs to be adjusted, or maybe the medicine that is being consumed is not therapeutically effective. Okay, so we also need to monitor our conditions and see the response that we're having. Another thing is that a lot of us just know, oh, I'm on the blue pill, I'm on the white pill, I think it sounds like this or it sounds like that. But we have reached the stage now where we definitely need to know the name of our medication. If you know the brand name and if you know the generic name, I applaud you for that. That is excellent. We need to know the strength of our medication. And if it has changed, we need to know why it has changed. Also, another thing that can tip us off is the taste. Some counterfeit medicines have a metallic taste. So also, if you're taking a medicine and it was tasting nice and cherry-like, and all of a sudden now you're tasting something like cement, you need to report that right away to the Ministry of Health or take it back to where it was purchased and let them investigate. Another thing that I would look for in purchasing my medicine, we are an English-speaking country, and we should not be importing medicine from some place that does not know our language. So if I am filling a prescription, what is on the box should be a language that I know, telling me the strength, the name, not something in Spanish, in French, or even in Portuguese, because we don't know where that came from.
You don't know what it is?
I don't know what it is either, and I don't know, you know. So we need to be careful about these things. A lot of these things can show us that they may be questionable.
So that's a list. Those are the things that you need to go.
That's our list. The main thing is to ensure where you purchase your medication from.
So you could go back there.
Yes,
and
you can go back there
and let the pharmacist know the challenges that you're having.
The chances are they are doing business with a reputable distributor or a reputable manufacturer.
Okay.
Okay.
Call us. The number is on the screen. Text us. The number is on the screen. We hope to hear from you. Now, this is not in the counterfeit area, but I think it's something that's important and a lot of people need to be aware of, because we've been having challenges with this as well. And this is the proper use of the medication, following the instructions. Talk to us about how to self-medicate and the importance of following the prescription accurately and exactly.
Okay, self-medication should be limited. That is what I will say on the first bit. If you...
When you say some medications should be limited.
Should be limited. Self-medicating.
Oh, self-medicating should be limited.
Yes,
okay.
Because if you are suffering from a condition for more than 3 days, it's no longer wise for you to continue to be self-medicating. You need to seek professional advice.
Okay.
Okay. If you are suffering with the influenza, yes, it may be the cold, but have it confirmed if it is taking a little longer, because then you may for some reason be developing an infection somewhere in your lungs.
Okay,
let me
clarify. Let me see to clarify that point.
Yes.
So if you feel a certain way, if you come down with a condition and you try to diagnose that condition yourself, you know, for example, you're sniffling, or you got a headache, or your eyes runny, or you got a scratchy throat and a pain in your stomach or something, and you're figuring, or maybe it's a flu symptom, and you decide, well, you don't need to go to the doctor, you're going to go and get an over-the-counter medication, and you say if you're taking that for more than 3 days and you're not getting any relief, you need to go and see a doctor.
You should go and see a doctor.
Okay.
Self-medicating should be limited. I'm not saying 3 days exactly.
Okay.
I'm just drawing a reference.
Okay.
Because the aches and the pains and so forth you can be having can be dengue. Maybe you got mosquito bitten and you didn't even know. Okay, so sometimes we have a lot of things starting out with aches and pains and fever that could develop into something that is more serious.
Self-medication should be limited.
I know a lot of us, we are internet savvy, we have internet at home, we are working with our iPads, and we are self-diagnosing, we are visiting WebMD.
We are own doctors now.
Yes, we are our own doctors, but we still need to be careful. We still need to be very careful.
Okay. And now when you do get a prescription, right? How important it is to follow the prescription exactly?
It's very important, because medicines work by what we call building up blood levels, and if you don't take it accordingly, you may not reach the right blood level in order for the medicine to exert its effect. Okay, so what I'm saying is that I may need to be taking medicine for like 2 days, probably a couple of hours before I can feel a difference. All right, so I need to read that blood level, and then I need to keep that blood therapeutic level there. And if I don't take it, if my medicine is prescribed to be taken every 6 hours, and I decided I'm only taking it every 8 hours, I may lose the therapeutic blood level. Because how our medicine is designed to work over probably increments of hours, 8 hours. So it will have its effect over 8 hours. Some are designed every 12 hours. Some are designed to stay in your body for 24 hours. So if you don't take it as prescribed, you may lose that vital blood concentration, and therefore the medicine will not work.
It won't be effective.
Right. And in reference to antibiotics, a lot of time, because we see an improvement on possibly day 2 or day 3, we decide we don't need antibiotics anymore. So we stop taking them. And what this does is basically you've had those little microbes in there, and you've given them a little bit of medicine. And they take that. But there are some that have not died, or some that have not been affected by the antibiotic. So they stay there and they get stronger because you give them a little bit. So the next time you do that, you keep giving them little bit, and you're discarding your antibiotic before time. Then eventually when you come down with a condition that needs antibiotic and you go to the hospital, we may find that there isn't any antibiotic that is working because those bugs, those microbes have developed resistance to the antibiotics. And because in the BVI, the misuse and abuse of antibiotics has been very prevalent, we are having challenges. I don't know if you remember last year when Mrs. Helen Frett was here from BVI Health Services and told us that there are 4 antibiotics that are no longer useful in the British Virgin Islands because of the same phenomenon.
So we need to do what the doctors say. If the doctor say take it 12 o'clock, take 1 tablet every 3 hours or every 4 hours. We need to take it in that prescribed time so that it's effective and it won't create a situation where the virus that is designed to treat doesn't get stronger and then the nullify the effect of the medication. Right.
I know sometimes everything has side effects, including medicines. So I know sometimes you take it, it might have a upset stomach, or you may feel nauseated or something like that. In the event, revisit your pharmacy, speak to your pharmacist, see if there is something that can be done to reduce that side effect, or visit your doctor and say, Doc, this medicine is not working. Can you give me something else?
Oh, you have this side effect from the medicine.
Right. There's always an alternative that can be prescribed.
Okay. Now, sometimes you go to the doctor and doctors prescribe medication that is a brand name medication that is very expensive. And I found this to be the case, particularly with seniors who can't afford high-priced medications. But the doctor will prescribe a medication and they can't afford it, and there is something else they could get instead, or a generic medication they can get instead at a much reduced cost. Is that something that seniors in particular need to talk to their doctors or their healthcare providers about, prescribing these expensive brand names when a generic medication is just as good?
Just as good. Just as good. Our seniors can speak to our physicians. I know some of us have the idea that we can't ask the doctor a question because I experienced that a lot at the hospital. Patients would stay in the doctor's office, yes, I understand, yes, I'll comply, yes, I'll take, and there's no question. But when they reach the pharmacy, it's one after the next. What is this for? But you just left the doctor. What did he say he was prescribing it for? What condition did you went to see the doctor for? So we need to speak to our physicians, and if we cannot afford, Doc, how much do you think this medication would cost? And he can probably call the pharmacy and ask the pharmacy to check it out for him, and he can let you know. So if he needs to prescribe something else, he can. And most countries now are actually moving to prescribing generics because it's more affordable, and generics are therapeutically equivalent. So
they're just as good. We just have to make sure they are what they are.
Yes, they're just as good.
Okay. Now, how we were talking off air about statistics in the Caribbean, regarding counterfeit drugs. How prevalent is it? What can you tell us about counterfeit medication in the region?
Well, no country has been untouched by counterfeit medicines. In the workshop that I went to in St. Martin, there were some countries that got up and said, oh, we have no cases of counterfeit medicines. And one participant became so irritated. He got up and he said, it is not that you have no cases, it is that you are not looking or you are not set up to find out if counterfeit medicines is coming into your territory. So that is very important for us to note. A couple of years ago, something was circulated from Guyana, where they had counterfeit medicines. Not too far behind it was Trinidad. They had counterfeit Viagra. As recently as last week, I was speaking to the director of the Barbados Drug Service, and they're currently following up a case of counterfeit medicines that they're actively pursuing. I spoke about the Avastin counterfeit anti-cancer drug that was last week in the US news, that there's a distributor in Barbados. So counterfeit medicine is in our region. As recent as 1995 in Haiti, 30 children died when they were taking, after they took the fever medication paracetamol. It was mixed with diethylene glycol, which is basically antifreeze what we put in our car batteries. And those children died. 89 people also died when they drank cough medicine from that same, in that same country. 89 cough medicine. And these are things, when you go to a pharmacy and you buy your medicine, you're not thinking on that, you're thinking on getting better. You know, so it's very puzzling. In Nigeria, 109 children died after they took counterfeit medicine syrup with the same diethylene glycol, and that was that mixture was traced to a company in Dutch. So we have to be careful as to where we are importing our substances from, because the medicine, the diethylene glycol, was supposed to be a solvent, a glycerin solvent. It was imported from Dutch, but the medicine was made in Haiti. So who took responsibility for those deaths? I don't know.
It's a serious business. We're going to take our final break, and we're going to see if anybody else wants to text or call us, and we're going to come back and wrap up. We're going to talk about any final comments you want to make before you go.
Yes.
Okay, so we're going to take a break for a word from our sponsors. We're going to come right back and wrap up. Or if you got some phone calls or you got text, some questions you want to have answered, now is the time to do so, because we fall under the tyranny of the clock. We'll be right back.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Roadtown, Tortola, BVI.
Welcome back to Spotlight. We are in the final moments of the program, and we have a text. Let me see. It says, "Great show, Eduenka, and a great job, Miss Wheatley. The show is very informative, and the information is well articulated. Where can I go to get more information on counterfeit medicines? Where can you go?"
Okay, you can visit the Office of Chief of Drugs. I'm located in the Betty Tofet building on the second floor in the Ministry of Health section, or you can call 494-3701 extension 4398. But I prefer for you to come by so that we can have a chat and you can pick up the brochures and get some more information face to face.
Okay, so that was a good question.
Yes.
Thank you very much for that. Okay. Now, you talk about testing quickly. What facilities we have here to test medicines? Okay.
In 2010, we bought a mini lab. We call it GPHF, Global Pharma Health Fund Mini Lab. We can test 8 therapeutic categories of medicine: antihistamines, antibiotics, anti-asthmatics, anti-inflammatories, paracetamol. And in those 8 categories of medicines, we can do 25 different tablets. So we can do like amoxicillin, paracetamol, salbutamol, prednisolone, and so forth. So we have been using the kit to periodically test medicines. We have tested medicines so far from People's Hospital, and all have passed. And it is my intention to try and test some within the private sector also, because we not only want to make sure that the medicine supply at People's Hospital is of standard, but also that the medicines prescribed in the private sector is also of standard.
Okay. Cool.
Yes.
So any final words?
Just to let the public know that we are on top of things as far as counterfeit medicines is concerned. We are doing our best at the Ministry of Health. We've had 2 workshops, 2 intersectorial workshops with customs, police, pharmacists, doctors, nurses, just to let them know where we are to sensitize them as to counterfeit medicines. We brought in a drug inspector from the Barbados Drug Service who went through with the police and the pharmacist how to go about inspecting for counterfeit medicines. And we also had one for the judiciary so that we can let them know that we need to seriously consider counterfeit medicine as a crime because it is being intentionally done. I remember the Director of Public Prosecution saying that, well, this is practically murder, because if you put cement in a tablet, you know it's going to kill. So this is murder, so the penalties need to be as such. So we were sensitizing the BVI. We are hoping to get, well, by this show we are getting to the public, so because we do not want to leave anyone out, and we are thankful of what we have accomplished so far.
Okay, well that's great, and I think it's important that the public know what to look for, how to protect themselves, and how to safeguard themselves from these various unscrupulous characters going around trying to make money off of our illness.
Make money off of our health.
Yes. Sister Gracia, thank you for coming. It's a real pleasure.
Thank you for having me.
And thank you for the information. And continue.
Always willing to share, Edgewinker. Always willing to share.
Continue the good work, and you could come by anytime.
Thank you very much. Next
week, the spotlight will be on the BVI Investment Club. Yes, a lot has been said about the BVI Investment Club.
Wow.
Lots have been talked about. As a matter of fact, the BVI Investment Club is a organization that is now known worldwide. A lot of countries in the Caribbean particularly want the investment club to talk to them about how they do it, how they are able to pool their resources together to help participate in the development of their country. A lot of people want to do that, and historically people of African descent have had challenges pooling their resources together to make serious economic impact in their countries and in their communities. And the BVI Investment Club has had some tremendous success in unifying and pooling resources to make significant economic growth and impact in the BVI. They are celebrating their 20th anniversary. It's 20 years they've been together as a group. It's a serious milestone.
Yes, very much
very
so.
Worthwhile milestone. And we're going to be talking with them next week about the importance of us pooling our resources for successful economic growth, how can we do it, how it's done, and the impact that they've had in the community over the 20 years that they've been together as an investment club, and how they've assisted other investment clubs in the BVI to develop and to have similar success as well. So it's going to be a very informative program. So tune in next week. Make sure you're here with Spotlight Tuesdays at 8 o'clock, and of course a rebroadcast on Sundays at 2:30 Sunday afternoons. So, and for those of you who missed the program or came on late, tuned in a little late, Spotlight is on jtvlive.net. You could go to the site and you could see all the spotlights past and even the one tonight, and catch up with what you've missed so far. So tune in to JTV Live, or log on, I should say, to jtvlive.net to get all the shows that JTV is online. Thank you for watching. Thank you for your words of encouragement. Thank you for your criticisms. Continue to email me at jtvspotlight@yahoo.com. I'm Edgewinker, reminding you that when the spotlight is on, you see the facts. Peace and blessings.
Spotlight is brought to you by CCT Global Communication, Data Pro, Orion Law, Clarence Thomas Limited, Virgin Island Motors, and Bolo's Wholesale Cash and Carry.